Thank you, Chairperson. I'm not a doctor. I think very few members here are. But the Minister is. Minister, it's actually sad that you sit there behind the corner because this is a debate we need to have, looking each other eye to eye. But it remains one of the most honourable things to do is to be a doctor, to take care for another. But as politicians, we work with ideas and policies and solutions and how we should implement them. So, Minister, just as good medicine, you will not like what I have to say today. Regard this as your much-needed second opinion. Public health care remains poor with little provision and a lack of expertise. On the other hand, the private healthcare sector remains its world-class standards, but remain expensive and inaccessible. But the FF Plus believes that the biggest challenge in public healthcare is not a lack of money, but a lack of expertise. Mismanagement and corruption have destroyed our healthcare system and institutions, and the ruling party is very well aware of this. But as a solution, the ANC and especially Secretary General have developed an infatuation with the Cuban healthcare system. And government sends students to Cuba and spend billions of rands in an attempt at addressing this shortage of doctors. Unfortunately, these doctors that were trained in Cuba have not been found fit to treat the health problems that are specific to South Africa. Speaker, through you, Minister, do not be misled by Cuban healthcare. This is what Cuba do not wish to tell you when they visit. Contrary to belief, Cubans endure extreme inequality of healthcare. Minister, you mentioned equitable funding for healthcare, but the next time you visit Cuba, ask them about the 3 tiers or the 3 levels of healthcare. One for foreigners who can pay with hard currency. This is called medical tourism. One for Cuban elites, such as government officials and celebrities. That's us sitting here. And then one for the common people. Speaker, clearly everyone is not treated as equally regarded of class or ability to pay there. And the Honourable Gillian should take note of this as well, because this is neither equality nor equity. Chairperson, Cuban doctors are also woefully underpaid. A young doctor would have to work for more than a week just to afford to buy milk twice a week. Medical care is free in Cuba, yes, but medication is costly and scarce, yes. Medication to hospitalized patients is free, but all outpatient medications have to be paid for out of pocket. And all medications, yes, Speaker, even your aspirin, require prescription. And then there's the whole issue of low mortality rate. I've heard this. Yes, it's low in Cuba, that's true, but it's owing to high levels of abortion. Doctors are urged to monitor pregnancies, monitor them, and if there's any sign of abnormality and any reason for concern, the pregnancy is interrupted, and that's a euphemism for abortion. The abortion rate in Cuba is sky high, perversely keeping the infant mortality rate down. Minister, you're administering the wrong treatment if you want to do it here. Voorsitter, spandeer eerder geld daarop om ons eie model te ontwikkel. 'n Suid-Afrikaanse model, wat tot voordeel van ons Suid-Afrikaners is. Speaker, I'm not asking for an American or a British or Australian model, especially not a Cuban model. I'm advocating for a truly South African healthcare system. Ons blinde loyaliteit teenoor Cuba gaan ons gesondheidsorg benadeel. Dit, voorsitter, is die verkeerde behandeling vir ons gesondheidsorg. Met die obsessie met transformasie gaan kundigheid steeds vir Suid-Afrika verlore, soveel so dat duisende kindergesondheidswerkers wat hier opgelei is, in die buiteland werk. Die VF+ sê verseker eerder samewerking tussen openbare en privaat gesondheidssektore, sodat kundigheid en fasiliteite gekombineer kan word. Die VF+ veroordeel ook die oorregulering van mediese fondsbedrywe. Fondse word oormatig belas en die netto-belastinglas op individue word vergroot. Minister, it has established a national partnership between private and public medical services. This will leave enough space for both these industries to function without any unnecessary restrictions. Also, public healthcare infrastructure must first be upgraded before the NHI should even be considered. Deputy Chair, through you, upgrade public medical healthcare infrastructure and appoint skilled healthcare workers. It's likely that many healthcare providers, especially the crucial specialists, as well as private healthcare companies will leave South Africa. Therefore, the FF Plus cannot support this budget, and we cannot support the NHI. I thank you.